What's up, everybody? This is Christian Brindle. Thank you for tuning in to episode 85 of the Everything Medicare Podcast. Today is Monday. I hope this episode finds you doing well, happy, joyful, warm, because it's summer. And I am excited about what we're going to be trying out here pretty soon. Okay, so what we're going to be trying out, folks, is we've been doing 2 episodes per week for probably a majority of 2019. Before that, we were doing an episode every week, but it was sporadic. You know, we weren't really sure on what we were doing with this whole podcast thing. Now we kind of know what we're doing as far as what's the most effective way to bring you content and information. So we tried out doing 2 episodes a week, which has been on Mondays and Saturdays. Now, this is extremely difficult for us to do some weeks more than others because, for those of you who don't know, we are not a broadcasting company. We're not a radio station or anything like that. We're insurance brokerage here at Christian Brindle Insurance Services and Brindle Insurance Group. And so we have to find time to squeeze in time for us to do these episodes, for us to do research on certain topics, for us to edit things, be able to put them up. It takes a lot of time for us. And of course, we don't charge anything for the podcast. And so, not saying that we ever will. This podcast will always be free. However, and we're happy to do it. However, we've just been kind of experimenting what we can and cannot do for you folks, because the last thing that I ever want to do is start a commitment for you to where, let's say we're doing 2 episodes a week and we just can't keep it up, and you get accustomed to 2 episodes a week and it gets drawn back to 1 episode a week and yada, yada, yada. So I've been very, very careful before we expand what we've been doing. So what we're going to start doing now is we're going to start attempting, and I just know this is not going to be easy. So we're going to give it a trial run because you all have been asking for it. I've been listening. And so we're going to attempt to do 3 episodes a week for the foreseeable future. Now, how we're going to do this during the Medicare enrollment period, which is basically our tax season if we were a tax office, I do not know. But we're going to find a way to do it, okay? And that's that. That is my big announcement for this episode today, is we're going to start bringing you 3 podcast episodes each and every week. So the new schedule will obviously be Monday. Monday will continue to be the first day, Wednesday and Saturday. So Monday, Wednesday, and Saturday, you can expect a podcast from me at the Everything Medicare Podcast. For those of you who don't know me, this is your first time listening, my name is Christian Brindle. I grew up around the Medicare industry. I'm a Medicare health plan expert and specialist. I've worked with a number of people over the years. I started when I was incredibly young, probably 20 years old, and now I'm 27, okay? And so I just have a passion for working with people on Medicare. I just love it. I love the feeling that I get when, I make something easy for people. And I learned early on in my career that I have a gift. I have a talent for breaking things down in a way for people that's easy to understand, for explaining a very complicated subject for most people in the form of Medicare in a way that people can understand. I learned that really early on. That's helped me tremendously in my career because people enjoy working with me for that aspect. And, I'm very grateful for that. I work with the best people in the world as far as the people that I work with as clients and customers. And I couldn't have better people that I work with. I'm just blessed in that regard. But I knew that there was more I could do to help people on more of a national scale. And that was bring you information, bring you content. If you haven't been following us on our YouTube channel that we just started, we've had the YouTube channel for about over a year, but we just dabbled in it, kind of learning how it works. Now we're committed to putting up 3 videos a week there as well. And also, all of these podcast episodes are up on YouTube as well. They go right up on YouTube right after they air, and with the advertisements taken out of it. So if you'd ever like to listen to one of our podcasts there, you're more than welcome to it. I'm fine either way. As long as you're getting the message and the message is getting out there, I'm fine. It doesn't matter to me what platform it's on. But we're going to be doing 3 videos a week, and we're going to attempt to have the same schedule. So Mondays, Wednesdays, Saturdays. Okay. So I realized early on that I have a talent for explaining things in a way that people can easily digest and understand when it comes to Medicare and a complicated subject. I have a method, I have a way about me that allows me to break it down and, put it into layman's terms for a lot of people. And I'm not telling you this to kind of pump myself up or brag or boast or anything like that. I'm just letting you know that I love helping people with this subject. I love what I do, and for that reason alone is why we do the podcast, why we're doing the YouTube videos, and we want to reach as many people as possible, because I feel like I'm doing a lot of good if we can reach as many people with our podcast as possible, and we can reach as many people with our YouTube channel as possible. And so, if you haven't already, head over to our YouTube channel, Christian Brindle, and there's just an emoji face of me. That's our company logo right now. That's what I looked like when we started years ago. I don't quite look like that today. I've aged a little bit, but yeah, go subscribe to the channel. Help us out there. We really appreciate it. So basically, folks, today's episode, I'll get right into it, is about cancer policies. I get asked about these all the time. Are they good? Are they not good? And the answer to that is really going to vary. I did an episode last year, I believe I did it during the enrollment period, where I kind of was very critical of people over-insuring themselves, picking up too much ancillary products. An ancillary product, folks, is something that goes on top of your Medicare. That would be your dental, vision, hearing programs, although I'm a big advocate for those. I think that they're very important for a lot of people. And, just a lot of people don't understand the benefit they can get from those programs. I've benefited from them tremendously myself, But dental, vision, hearing programs, hospital indemnity programs, cancer policies, things along that nature. So what I want to talk about today is, in what type of situation can someone use a cancer policy, and how do they work? So I think they can be very useful in the right setting. So let's start out by talking about some facts, okay, some numbers. 1 out of 4 people will get cancer in their lifetime. That's a new statistic that just came out that we've studied. 1 out of 4. That's terrifying to me, okay? So that means every single person listening has a 25% chance of getting cancer. Now, I don't want to put you in that mental state of mind. I'm not trying to do that to where, you're getting nervous or scared or anything like that. That's not what I'm trying to do. I'm just trying to talk about the facts that we face today. So you must be thinking, well, my Medicare plan will take care of me. Well, no matter what type of Medicare plan you have, you're going to have certain limitations, and let's talk about those. So I've always talked about how there's 2 sides of the coin as far as which way you can go with your Medicare. There's your Medicare supplements on one side with your Part D drug plans that works with original Medicare. These would be your letter-based plans, your Medicare supplement plan F, plan G, plan N, plan H, plan K, plan L, et cetera, et cetera, et cetera. I don't even think there is an H, but plan K, plan L, plan M, plan, you get the point. On the other side, you have your Medicare Advantage plans. So both sides have some potential for some risk. Okay, so let's start with the Medicare supplements, where I'm sure most of you are thinking, well, how do we have risk for Medicare supplement? We have full coverage or close to it. Yes, as far as radiation is concerned, any medical procedures that are done as a result of the cancer, if they have to do any surgery to remove it, whatever the case might be, you are in a situation where you have full medical coverage, if not very close to it. Okay? And these are the people that probably don't need a cancer policy as much as the other side of the coin. However, there is some potential for risk there, and that is on the drug side. When you have cancer, you typically end up taking very expensive prescriptions, depending on the type of cancer you have, of course. But this ends up being the time period where you're taking very expensive medications. You end up taking a lot of prescriptions that, with a lot of insurance companies, you will fall into a tier 5 category, or maybe you're taking 1 or 2 or something like that. And when you have a Medicare supplement, whichever Medicare supplement you have, whether it's F, G, N, etc., this Medicare supplement works as the secondary to Medicare. It supplements your Medicare, helps pay your medical bills. So, together they pay your medical bills, but Medicare on its own does not cover prescription coverage. That's what the drug plan is for. That's what the Part D drug plan is for. When you have a supplement, you basically have 3 policies you're working with. You have your Medicare A and B, which is your primary for medical coverage. You have your supplement, which is your secondary for medical coverage. And the rule with the supplement is if Medicare pays, it will pay. If Medicare doesn't pay, it won't pay. So it doesn't cover anything that Medicare does not cover. That's why you have your Part D drug plan, D for drugs, through another insurance company or just a private insurance company in general. It's really not related at all with your supplement. It could be the same company you picked the supplement up through. It could be a separate company, but it has no connection in that regard. So with the supplement, it's not going to help with your prescription costs if they're what's known as Part D as in dog. Now, this is where it gets kind of tricky for some people. In the Medicare world, you have Medicare Part D drugs and Medicare Part B as in boy drugs. Medicare Part B as in boy drugs fall under Medicare Part B, which means they are medical costs. Now, a Medicare Part B drug, an example of this would be a high expensive injectable that you get in a doctor's office. So it's a prescription, but they're giving it to you. You can't get it filled at the pharmacy and take it home and take it on your own, in layman's terms. Okay, that would be a Medicare Part B drug. So that's going to be taken care of by your Medicare and your supplement. It's your Medicare Part D drugs that the drug plan falls under. Now, you might say, well, I have the drug plan. Doesn't that protect me? Well, yes, but with Medicare Part D plans, you have co-pays, obviously, and then you have situations where you're going to get into the coverage gap, donut hole, whatever they're going to call it, going forward into next year. But there will be a coverage gap next year, like there always has been. And if you don't know what the donut hole or the coverage gap is, go back and listen to some of my previous episodes about that. I'm not going to get into that today. Basically, because of high prescription costs that could come with being on cancer, depending on the type, you end up in the donut hole, and you can still end up paying thousands and thousands of dollars out of your pocket, and that's where they can get you. Let's switch gears to the Medicare Advantage side of things. So the Medicare Advantage side of things has the same risk, drug coverage, because they follow the same rules and regulations. They have the coverage gap, same as Medicare Part D plans do. They kind of go by the same guidelines, same structure, same everything in that regard. They have different formularies, of course, but a Tier 5 drug is probably going to be a Tier 5 drug with every company and every type of plan, 9 times out of 10. So you have that risk. That's no different. But when you have a Medicare Advantage plan, the medical coverage works quite a bit differently. So with Medicare Advantage plans, keep in mind, you're running your Medicare through a private insurance company. They take the place of your Medicare, okay? So they get funding from Medicare to do this because Medicare doesn't have to pay 80% of your medical bills any longer. This Medicare Advantage plan is going to do it for you. They're going to take over as your primary and in most cases your only insurance, okay? And they get funding from the government to do this, so typically they come at no premium or very low premiums, $20, $30, $40 a month, give or take. Depends on your market and where you're listening to this from. But anyway, that's your Medicare Advantage plan. And for medical bills, you have co-pays. Think $5 to $10 for your primary care doctor. Could be $0, depending on where you were listening to this from. $40, $50 for a specialist. Could be more, could be less. Depends on where you're listening to this from. $80, $90 for an emergency room. $200, $300, $400 a day in the hospital. So you have these co-pays. But where they really add up on a Medicare Advantage plan is most Medicare Advantage plans that I have personally worked with and seen, and I've worked with and seen a lot of them, they will pay 80% of chemo and 80% of radiation and leave 20% behind for you. Now, that's a huge cost, dramatically huge cost. So, how does that work? Well, is that an unlimited amount? Well, no. Most Medicare Advantage plans, actually all, are required to have what's known as a maximum out-of-pocket. So that's like a safety blanket for you, meaning that once you've paid that amount in medical copays in a calendar year, they pay 100% of your medical bills for the rest of the calendar year. So you have a safety blanket involved. Usually, it depends on your market, but it could be $3,000, $4,000, $5,000, $6,000, $7,000. The highest one this year is $6,700. So probably anywhere between. But still, not a lot of people can fork up $6,000, $7,000 and not hurt. So that's where a cancer policy can come in. Now, stay with me into segment 2, and we will talk about specifically how these cancer policies work and what to look for. Don't go anywhere. Welcome back, everybody. Segment 2, this week's Everything Medicare Podcast, episode 85. I'm Christian Brindle. Thank you for sticking with me. Today we're talking about cancer policies. So in the last segment, in segment 1, we kind of talked about where the risk lies depending on your particular situation. Even if you have a Medicare supplement, there are some risks involved. There's obviously less because you don't have the medical bills, you don't have the radiation and the chemotherapy, 20% coinsurance to worry about like you do with most Advantage plans that out there. And so, but you still have the prescription worry and a lot of, depending on the severity of your cancer, there's different medications you have to take on your own, and they're typically rather expensive. Now, can you get them from Canada, Mexico, other places like that? Well, I'm not a doctor. I'm not going to pretend that I'm a doctor. And if you want to take that route, that's completely on your decision. If you fall into this category, you probably get the prescription cheaper. You probably will. I don't know anything about the quality or if they're the same medication or anything. So some people are okay taking that risk. Some people want to make sure that they get it right. So it just depends. It just depends on, your knowledge on that. I'm not knowledgeable enough to comment. So let's just assume you're getting them here in the United States. Obviously, there's something to be said about our country as far as the prescription costs. And I'm not going to get into that too much, but I think that it's something that, is a problem, and hopefully it's the problem that gets resolved some manner at some point. Basically, this is what the cancer policy will do. A lot of cancer policies, there are different kinds out there, but they'll have you pick anywhere between, let's say, $3,000, $4,000, $5,000 up to $60,000, $70,000, $80,000, $90,000, $100,000 payout. Okay, depending on the product, there's a lot of different types out there. There's some that are cancer, heart attack, and stroke, so they do all three of those, and they help pay out for all three of those. There's some that are just cancer. I think typically those are going to be less expensive than the cancer, heart attack, and stroke plans, from my experience anyway. But basically the cancer policies, depending on what you want, the premium's going to vary based on how much the payout is going to be. Okay, and that's how much they'll pay out. So, let's say you have a Medicare Advantage plan that has a $5,000 max out of pocket. Well, you could get a $5,000 cancer policy and you're protected. You're probably going to pay, depending on your market, this isn't going to be the case in all markets, so please bear with me on that. But you're probably going to pay in the 20s as far as premium is concerned. If you wanted to get a little extra because of the extra concern of the prescription coverage on a Medicare Advantage plan, you might want 10. I think that's probably a good amount. Or you can just, you can have a lot of coverage. I mean, granted, I usually only see the people that get the very, very high amounts of coverage do that if they don't have any health insurance or very crappy health insurance. If you have a Medicare supplement or Medicare Advantage plan, probably don't need $60,000 of coverage. Okay, let's be realistic here, but probably, you probably could benefit from a $10,000 policy, or maybe a little more. It depends on what you need, So in that type of situation, cancer is something that a lot of us are more likely to run into, as much as I hate to say it, including myself. And it's a situation where, ever disparage anybody from picking up extra protection, because even with the Medicare supplement, even with the Medicare Advantage plan, with what I've laid out here for you, there's holes that still exist in that type of situation. With Medicare supplement specifically, the drug costs, Medicare Advantage plan, the medical costs, and the drug costs. So it really just depends on your comfort level, but I don't necessarily think the cancer policy is a bad option for probably most people to pick up if you can comfortably afford an extra smaller premium. But it might just help you out. It might just help you out. I mean, granted, if you have no history of cancer in your family and you've never had a scare and you're healthy as a horse, I get it. I get it if you don't feel like it's necessary. I'm not saying this is something that everybody should do, but I think a lot of people should consider it, and a lot of people don't end up picking it up or are unaware that it's out there and they end up regretting it. But at the same time, I'm also a big advocate for not making your self-insurance poor. So you have to take these things into consideration. You have to look at your budget. You have to look at your income. You have to look at what you can comfortably afford as far as premiums are concerned. I'm a big advocate for protection. I am so protected, you wouldn't believe it. Car insurance, homeowners insurance, medical insurance, although I do it a little bit differently. Go back to the cost-sharing plans if you ever are curious about that. Dental, life insurance. I mean, I am insured very, very heavily, but that's just because I've seen a lot of things. Everybody. And so I'd rather shell out the premiums to protect myself than have to worry about it down the road. Stay with me into segment 3. We'll wrap this puppy up. Welcome back, everybody. Thanks for sticking with me to our third and final segment. I just wanted to wrap up this episode while reminding you that the Medicare open enrollment period is getting closer and closer. We're in the middle of August right now. The Medicare open enrollment period starts October 15th, goes through December 7th. Okay, so that's when everybody can change their plans. It's kind of like a free-for-all. You can pretty much go wherever you want to go. You can go from Medicare Advantage back to original Medicare. You can go from original Medicare back to Medicare Advantage. You can go from one Medicare Advantage plan to another. You can go from a Part D plan to another Part D plan. We're going to be doing more episodes about the enrollment period and kind of what I recommend looking for, and just in general what might be a good idea to do during the enrollment period. But you'll start seeing advertisements. You'll start seeing everything. You'll start seeing more commercials, phone calls, things in the mail that really don't tell you anything about the plan, that are just designed to draw you in from every insurance company you've ever heard of, and probably a few that you haven't heard of. You might even have somebody come to your door. My advice with this stuff, and I'll go into this in more details, but I just thought this would be a good topic to just close out this episode on, is you're going to get swarmed with information. Make sure that you're working with somebody on your Medicare that is unbiased, carries all the options, can help you find the best fit. It's very, very important, folks. Very, very important. And you don't want to just sign up for something because you saw a commercial that looked nice. Don't do that. Commercial's not telling you everything you need to know about that plan. Make sure you're educated on what you're picking, and make sure you're making the right decision. Make sure you know how your own plan is changing before you make any changes, because you want to make sure that it's going to be an upgrade. That's my biggest advice to you. As always, folks, if you're on Medicare and you'd like to revisit your plan, just to make sure that you're on the best thing for you, maybe you're not sure, or maybe you're turning 65 and you're just not sure which way to go and you're getting on Medicare for the first time, regardless of your situation, if you live in Utah, Idaho, Florida, and now Oregon. We actually don't have our license yet for that, but we should have it any day now. We will be moving into Oregon as our new fourth state, and we'll be adding more in months to come. I can help you on your plan. I'd love the opportunity to talk with you. If you'd like to talk with me for a free, no obligation consultation, we give year-round customer service. I communicate with my clients through a newsletter monthly, every single month. And the service we provide is just head and shoulders above most other organizations out there. I've never had anybody be disappointed with the service we provide. Let me just put it that way. And it's not just a situation where we help you do a plan and then you never talk to us again and we're just done with you. We don't answer the phone. We hide under our desks when you call. It's not that type of situation. We have the attitude that we're going to have a long-lasting relationship with you. We'll keep you updated on changes, everything you need to know. So we'd love the opportunity to be able to talk with you. Give us a call at my office, 801-255-5340, 801-255-5340 in Utah, and ask for Christian. I'd love to talk to you. And, I can't always promise that we can help you. I can't always promise that you're not in the best situation you can possibly be in. But at the very least, it's never a bad idea to take a look at it. Also, if you're in one of the other states that we don't work in, and there's a lot more that we don't work in at this point than we do, I wrote a book for people just like you. Usually it's $5.50 per month on Amazon. It's called Medicare Guidance, Picking the Plan for You. I'm giving it away from now till the end of the month, so the end of August. So don't waste this opportunity. Please, what you need to do to get it for free is go to Apple Podcasts. If you have an iPhone, you can find it on the purple app that says Podcast on your phone. If you don't have an iPhone, you can Google Apple Podcasts, the Everything Medicare Podcast, Apple Podcasts. Leave us a 5-star review. Say something nice. Say something that you like about the podcast, and send me an email with a picture of it. Take it with your phone, or have your kids help you if you need help with it. Send me an email with your first name, a good address I can mail the book to, and we'll send it to you free. No cost, nothing. That's going until the end of the month, so don't miss out on that. After August comes and goes, you will not be able to get it for free unless you're a client of mine. So don't miss out on that, folks. Thank you so much for watching. Thank you so much for listening. And we will bring you another episode on Wednesday. This is going to be our first 3-episode week going forward. So we'll see how you like it. Take care.